Hello everyone, this is a complimentary recording, the 1 hour missed recording for the starting session, the first session of our course. You will find the first recording starting from the psychiatry history. The first 1 hour was missing, so I'm going to record it right now for the people who missed it. Okay, today is the start of our course, of our 15 days course. We say that we are going to start by showing how to elaborate the history in details. What I'm going to do right now is that I'm going to provide you with each and every complaint, almost each complaint you will need to elaborate in PLAB 2, and how to formulate or how to set a specific pattern and special approach for each kind of scenario. So in this case you will not need to remember too much or memorize too much from the script. What you will do, you will just learn how to elaborate the symptoms, each symptom that I'm going to say right now, learn how to elaborate them. And for example, if you are having someone with tummy pain, you will fix a certain approach for the tummy pain stations. Like you will elaborate the tummy pain, you will ask about the possible associating symptoms with the tummy pain, fix these symptoms in each and every station, and you will never be disappointed in any history taking station. Okay, so today we are going to speak about number 1, history taking, number 2, interpersonal skills and the other communication skills as well, number 3, management skills, number 4, approach to the counseling stations, number 5, approach to the ethics stations. Ethics stations are different compartments. You will see them while you are studying for the course. The ethics stations generally are angry patient, breaking bad news, assessing mental capacity, decision making, dealing with a colleague, dealing with a senior. They are different compartments. So in the ethics station they are separate and you will see them during the course. Let's start with the simple things first. What are the things that we need to discuss today? We will elaborate the different complaints. So basically we're going to start with the history taking. Everyone knows here that PLAB 2 is, you are marked in PLAB 2 upon 3 fields. Number 1, history taking. Number 2, interpersonal skills, or what's called communication skills. Number 3, the management, the clinical management. And please mind the clinical management. This is basically the aim in this course, to show you how to be concise and how to be straightforward in the management, because you will find it crammed in many scripts in the academies. We don't need this. We just need few points of the management to save our time and our marks as well, because there is a very important portion in the management, which is patient involvement. That's why many people miss in the management, because they do not involve the patient enough. So number 1, we are going to speak about the first field or the first domain, which is the history taking, or what's called the data gathering. In the data gathering, simply before taking the history, you always enter to the patient and say, hello, I'm Dr. XX, one of the junior doctors in this department. How can I confirm your name and age, please? He will say, for example, my name is XX and I am, for example, 50 years old. Okay, nice to meet you. Would it be okay if I call you John? Yes, doctor. Nice to meet you, John. Thank you, doctor. So how can I help you today? Now your history portion or history taking portion will start. Basically the patient will give you the complaint. Let's start with elaborating each and every complaint in details. Number 1, we're going to elaborate the pain. The pain itself is a very direct and straightforward complaint, though many people miss it. Why do people miss the pain elaboration? Because simply the SOCRATES, they do not learn SOCRATES well. How to learn SOCRATES well? I have a very good idea. When someone tells you I'm having pain, the first thing you do, oh, I'm so sorry to hear that. Are you comfortable to talk? So number 1, you assess the comfort in any pain. Assessing the comfort is a very important portion in your communication skills. The communication skills are basically about how you are going to be nice to the patient and how you are going to involve the patient. Do not trust the people who tell you that I got high marks in interpersonal skills though I was not good. Listen, the interpersonal skills or the communication skills are involved in the interpersonal skills, involved in the management, involved in the data gathering. So you will find yourself marked in the interpersonals in the 3 fields, not only in the field of the interpersonal skills. I hope you got that. So while the history taking, for example, if you assess the patient comfort, you will have a mark in your interpersonals. You gain the patient rapport and you gain the patient trust. You show you are a caring doctor or compassionate doctor. So that's number 1, you're going to ask the patient comfort. Oh doctor, I can manage, thank you. Okay, now tell him, don't worry, we are going to sort it out for you. Just I'm going to ask you a few questions to be in a better position to sort it out for you or to help you. So keep reassuring the patient that we are going to sort it out for him. So this is the first 2 steps: comfort, assess comfort, and reassure. Number 3, now ask the patient. Most of the people go like, where is the pain? When did it start? How did it start? Has it changed? No, you don't do this. First thing, always in any complaint given to you by the patient, you will ask open question. For example, you are going to tell the patient, tell me more about this pain. Can you tell me more about this pain? Always any complaint given you to the patient by the patient in PLAB 2, always ask this question: tell me more, tell me more, tell me more. This question is very important, and actually it is the most important question in your history taking. Why? Because this question can cut your way short toward the diagnosis in few seconds. Many people do not ask this question and they end up asking plenty of questions just to reach the point. But if you ask this open question, you will reach the point in few seconds because you will gain it from the patient words, not from what you are going to ask about. So tell me more about this pain. Okay, most of the patients will tell you, for example, I'm having chest pain, doctor, and the doctor, this pain is in the center of my chest. I'm feeling like there's a squeeze in my chest, doctor, since 2 hours. So he will tell you a good story, a detailed story. But some other patients will tell you what you want to know, doctor. So in this case, you have to ask what's called closed questions. So the open question is always tell me more. The closed question is what you are going to say right now. For the pain, we elaborated by SOCRATES. Site, onset, character, radiation, aggravating and relieving factors. Okay, and radiation as well is very important. Character of the pain and score of the pain. Okay, so we are going to say, for example, where is the pain? When did it start? Has it been continuous or comes and goes? Has it changed? How did it start? Does it go anywhere else? Did it start anywhere else? And please, this question, mark it in the tummy pain because it's important differential diagnosis for appendicitis. So has it started anywhere else? Anything makes it better? Anything makes it worse? Can you describe the pain for me? On a scale of 1 to 10, 1 being the lowest and 10 being the highest, can you score your pain for me? So again, the questions to elaborate the pain, make sure that you ask at least 7 of them. At least 7 of these questions. Number 1, where is the pain? When did it start? How did it start? Has it been continuous or comes and goes? Has it changed? Does it go anywhere else? Did it start anywhere else? Anything makes it better? Anything makes it worse? Can you describe this pain for me? On a scale of 1 to 10, 1 being the lowest and 10 being the highest, can you score this pain for me? Note that if the patient tells you that the pain is coming and going in episodes, If the patient tells you that it is episodic pain, now ask him how many episodes, what were the timings of the episodes, could you think of anything which bring these episodes of pain? So these 3 questions are important if the pain is episodic. Again, number 1, number of episodes. Number 2, timing of episodes. Number 3, anything which could bring them. Note that it is not important to follow an order in the Socrates. But what I'm telling you is the right thing to say. It is the right chronological order to say. I mean the order of the questions. After elaborating the pain, you do not ask about anything else. Always, after elaborating each complaint, ask the patient, do you have anything else? So I said the open questions are very important. So instead of asking, most of the people after asking about the pain, they go and ask about, for example, do you have any nausea, any vomiting, any sweating? No. After elaborating the pain, you will say, do you have anything else? Why? Because in the tummy pain stations, this open question will give you the diagnosis. Otherwise, you will end up asking about many differentials. And they are too much. Okay. Any other complaint apart from the pain? So the pain is the most challenging complaint. What I need you to do, I need you always to memorize these set of questions to elaborate the pain, the Socrates questions. I'm not kidding, you have to improvise them, like try standing in front of the mirror, just try to memorize them and improvise them every now and then. Why? Because you have to elaborate the pain in details in 1.5 minutes in the exam. Less than 1.5 minutes in case it is a presenting complaint. So you have to be quick and fast in pain elaboration. I see that many people spend more than 2 minutes in just elaborating the pain because they have been just trying to memorize the questions. And yes, you have to elaborate in details because, guys, please always keep in mind that the presenting complaint must be elaborated in details. The presenting complaint. Any other complaint, you can cut it short, no problem. Okay, so after the pain, I'm going to ask the patient, do you have anything else? Like what, doctor? Now you'll have to ask the closed questions which can be related to the presenting complaint. For example, when we proceed in the course, you will find that the chest pain is a presenting complaint. So what could be the associating symptoms with chest pain in any patient? Number 1, shortness of breath. Number 2, cough. Number 3, fever. Number 5 could be nausea and vomiting. Number 6 as well could be some sort of heart racing. So when we proceed in the course, you don't need to worry about that. You will find these things are very much repeated. But you have to fix your history taking pattern, as I tell you, that for each presenting complaint, try to fix in your mind certain set of associating symptoms to ask in any station, in case there's a change in the scenario or in case they bring a new station in your day. You would know at least how to take the history efficiently and get the 4 marks of the history, or at least 3 of them, and good marks in the interpersonals by applying the way that I'm telling you, open questions, assess patient comfort, and in the management, hopefully you will get to know about it. Okay, so number 2, the other complaints apart from the pain. How to elaborate them? Simply in the other complaints, I'm going to ask, when did it start? How did it start? Has it been continuous or comes and goes? Has it changed? Anything makes it better? Anything makes it worse? I'm going to send you like some sort of notes regarding the history taking. What I'm saying right now will be given to you in a note. I'm going to send it to you, just few papers to teach you how to take the full history in PLAB 2. They're really worth reading. They will just take you maybe 15 or 10 minutes only. But imagine these few papers, like 5 or 6 pages, are worthy because they will facilitate or cut your way short in PLAB 2 too much more than you think. Okay. Special note. If there is any long-standing complaint, like, for example, if there is any prolonged tiredness, any prolonged shortness of breath, any prolonged sleeplessness, any prolonged complaint, you have to ask the patient, does it come at any specific time of the day? you have to ask about, does it come in any specific time of the day or not? This is number one. Number two, also in the long-standing complaints, you have to ask about psychosocials. Like what? Simple question in psychosocial, in the medicine stations or in the history-taking stations. Ask one question only. How has this affected your life? Because, for example, someone who is having prolonged tiredness, definitely this would have a big impact on their lives. Like, for example, this one cannot perform any activity, this person cannot go to work properly, this person is disappointed because he cannot attend the friends gathering, he cannot go to parties, he cannot perform any physical activity. So those are the things that I'm asking this. Why this is important? This will give you good mark in the rapport with the patient, and as well this will help you explore many things. For example, when you ask the simple question, the patient will tell you, oh doctor, I'm feeling tired since 3 months, I cannot do any physical activity, I used to be physically active but not anymore doctor, he will tell you a full story. But imagine that from this full story he will cut your history taking short. Why? You will see now why. So number one, pain. Number two, any other complaints, and we give two special notes about the long-standing complaints. Number three, one of the presenting complaints as well, or one of the most important complaints, are the discharge. What discharge? Discharge means any discharge from the body, including the vomiting, including diarrhea, including bleeding itself, including vaginal discharge, including the cough itself sometimes can be associated with phlegm, and the phlegm is sort of discharge as well. So any discharge or any fluid coming out is called discharge. How to elaborate it? Like any complaint. When did it start? How did it start? Has it been continuous or comes and goes? Has it changed? What is the color of the discharge? What is the amount? And what is the smell? And if there is any blood or not? So again, amount, color, smell, and if there is any blood. Those are the four special questions to any discharge. Okay. Number four, regarding the constipation. Like any other complaint, I told you the pain is the only unique complaint, but any other complaint I'm going to ask when did it start, how did it start, has it been continuous or comes and goes, has it changed, anything makes it better, what about anything which makes it worse. But for each complaint there is specific questions. In the constipation, you would ask the patient, when did you last open your bowel? And when did you pass wind the last time? Or when did you last pass wind? And if there are any episodes of diarrhea in between. Why I'm asking these three questions, like when did he last open the bowel, when did he last pass wind, and when any episodes of diarrhea in between. This is very important to exclude the intestinal obstruction. Number five, the skin lesions. In the skin lesions, I would ask about number one, the site. Where is the lesion? Number two, the size. Tell me about the size of the lesion. Is there any change in the size? So number one, the site. Number two, the size, and if there is any change in it. Number three, the shape of the lesion, and if there is any change in it as well. Number four, the color of the lesion, and if there is any change in it as well. Number five, if there is any bleeding from the lesion. Does it bleed? Any ulceration from the lesion? Any discharge coming out of the lesion? Very important to ask these questions in any skin lesions. Why? The skin lesion stations simply are separate entity. For example, the patient will be presented only with a skin lesion. So these like 8 questions or these 7 questions, these 10 questions are very important to be asked totally. You can also add if there is any itching, but please make sure that you elaborate the skin lesion in details, because this is the only presenting complaint, and these stations are usually short. Your history taking can finish in 4 minutes. So please ask these questions in details and do not cut it short. Very important note, in the skin lesion station, during your history taking, I need you to remember 3 important points. For example, now you asked about the presenting complaint and the associating symptoms, and then you move to the past medical history. After the past medical history, you will ask about the lifestyle. After the lifestyle, you have always in the skin lesion station, you have to ask about the travel history, if he has traveled recently or not, if he has been recently exposed to the sun or not, and what is his job. Why these questions are very important: travel history, sun exposure, and job. Why? Because prolonged sun exposure is a precipitating factor to develop skin cancer. So this is in the pattern of the history. Number 2, the most important differential diagnosis in the skin lesion stations is the cancer. How to ask about the cancer? Your differential diagnosis about the cancer will be asked like this: do you have any loss of weight? Any loss of appetite? Any shortness of breath? Any tiredness? What about any heart racing? The shortness of breath, tiredness, and heart racing are symptoms of anemia, and the anemia is one of the symptoms of the cancer. So if you wanna rule out the cancer in any station, always ask about these questions: loss of weight, loss of appetite, and anemia symptoms. Number 3, in the skin lesion station as well, do not forget to ask about the family history of skin troubles or skin problems. Why? Family history is one of the precipitating factors as well of skin cancer. So again, the 3 important notes: number 1, ask about the travel history, sun exposure, and job. Number 2, rule out the cancer in your DDs, your differentials. Number 3, ask about the family history, which is pretty important. I just need to illustrate something in case someone does not know about that. Our history taking in PLAB 2 is: number 1, elaborate the presenting complaint. Number 2, ask the associating symptoms. What are associating symptoms? Which means the symptoms that could come with this complaint to any person. Like for example, someone who is having chest pain, as I said, this person could be having also, beside it, could be having like some sort of cough, could be having fever, could be having sweating, could be having nausea, could be having vomiting, could be having shortness of breath. These are the associating symptoms which can be presented alongside the chest pain to anyone. So this is number 2, the associating symptoms. Number 3, the differential diagnosis. Differential diagnosis is that, for example, I'm suspecting that this person is having acute coronary syndrome, and I asked all the symptoms that could be associating with the chest pain. What could be my differential diagnosis here, which were not included in the symptoms? For example, one of the most important differentials are the pulmonary embolism. How to rule out the pulmonary embolism? I'm going to ask the patient: have you had any redness or swelling in your legs recently? And about the injury, I'm going to ask the patient: have you injured yourself recently? So those are the 2 DDs which were not covered by the associating symptoms. Okay, after the differentials, I'm going to ask the past medical history. Some academics call it the maftosa. The past medical history is a maftosa as well. What is the past medical history? Number 1, has this ever happened to you before? Number 2, how was your health recently apart from what you said? Number 3, do you have any medical condition? And if the patient says no, you have also to ask 2 closed questions. Like for example, do you have any high blood pressure, any high blood sugar? But always ask open question first. Do you have any medical condition? In case he says no, always ask about high blood sugar or high blood pressure at least. Do you take any medications? Question number 5. Do you have any allergy to any food or drugs? Number 6. Have you been hospitalized in the past? Number 7. Have you undergone any surgery before? Number 8. Any family history of any medical problem? What about any family history of any similar problem? So there are 8 questions. Previous episodes, recent health, medical conditions, medications, allergy, hospitalization, surgery, family history. This is the 4th part of your history. Number 1, presenting complaint. Number 2, associating symptoms. Number 3, differential diagnosis. Number 4, the past medical history. Number 5, the lifestyle questions. Lifestyle includes: do you smoke? Do you drink alcohol? Are you physically active? Tell me about your diet. So alcohol, smoking, diet, physical activity. And in some few cases, if relevant, you can ask the patient, I'm sorry, but by any chance do you take any recreational drugs? Okay. We will, during our course, we will add some questions from time to time to each scenario when it's relevant. So please make sure that you concentrate. So far in the skin lesion station, we added 3 important notes, which are: after the lifestyle, I'm going to add the travel, sun exposure, and job. In the differential diagnosis pattern, I must ask about the cancer. And in the past medical history, I must ask about the family history. Usually we ask the whole questions of the past medical history, but I mean, in case you are running out of time, you have to focus more on the family history here in the skin lesions. I mean, those questions not to be missed at all. If you miss these questions, you are more likely to not gain marks in your history taking. Okay, one other complaint is the breast lump. The breast lump elaboration is similar to the skin lesion. How? I'm going to ask the same questions as a skin lesion, but I'm going to ask few more specific questions. Number 1, regarding the nipple. I'm going to ask if there's any nipple retraction, any bleeding from the nipple, and any discharge from the nipple. Number 2, the armpits. I'm going to ask about any lump in the armpits or any changes in the armpits. Important notes. In the breast lump stations, do not forget to ask about the cancer as well, and do not forget to ask about the family history. And please do not forget the 4 P's. What are the 4 P's? 4 P's usually come after the lifestyle questions, and they are: number 1, when the P number 1 is a period. When was your last menstrual period? Is it regular or not? Any heavy or painful bleeding? So this is the period itself. Number 2, the pills. Pills here means contraceptive pills. Do you take any contraceptive pills? Or do you take any form of contraception? Have you ever used any form of contraception? The 3rd P is the pregnancy. Have you ever been pregnant before? And please do not forget to ask about if there is any previous pregnancy, when was it, and what was the outcome. Okay, so in the breast lump, do not forget to rule out cancer, do not forget to ask about the family history, and do not also forget to ask about the 4 P's. Okay, now we are done with the breast lump. Let's move to the challenging part, which many people miss: the sexual history. How to take sexual history? First of all, please, when you are taking sexual history, you do not look stressed, you do not look embarrassed, you do not look judgmental, because many people they find that sexual health questions are embarrassing just because they are not used to ask them in their countries. Okay, that's true, but the problem is that actually what happens is that the simulator, him or herself, they stress you more by showing you that they are embarrassed, or that you are asking something embarrassing to them. So what to do? Before asking sexual history, you always to tell the patient, I'm going to ask you few personal questions. As medical professionals, we are used to ask them to all our patients. So please, do not feel embarrassed. So again, I'm going to ask you a few personal questions. Some of them may sound strange or some of them may sound embarrassing, but as medical professionals, we are used to ask them to all our patients. Learn how to say this sentence in a nice way and fluently, to sound natural. I do not want you to cram many things in your history taking. Do not be too structured in the history. Do not be too structured or too scripted, in your history taking. I just need you to be flexible. And the people actually, many people, they do not get good marks in the history just because they are not structured. They ask everything, but not in a structured way. And basically, in this course, you will learn how to be structured more than anything else, because the structure matters to me, because this is the key to you being organized and you finishing the whole script. I mean, in terms of study, when you are studying the script, you will finish, if you are structured, you will finish the whole script maybe in 10 minutes, ultimately. Okay, so for the sexual history, I told you what to say before taking it. This is what we call signposting. Signposting means that to show the patient that I'm going to ask about something. Okay. For sexual history, first question, are you sexually active? Number 2, do you have a stable partner? Number 3, if the answer was yes, number 3, do you practice safe sex? By any chance, any unprotected sex? And when was that? I'm sorry to ask you, but by any chance, any other partner? Okay. If there's any other partner, you will ask, was it unprotected or protected sex? You will find in the notes that I'm putting some winking marks. Winking means that I'm winking to you just to show you that you do not need to be judgmental in this portion, and you need to mind your facial expressions when you are asking them. Some people are asking this question, for example, in the HIV stations or in the gonorrhea stations. You'll find that many people are failing this station because of the rapport, not because of their history, no, because of the rapport. Why? Because simply the simulator does not feel comfortable to them. Simply, he feels that you are either like asking like as if you are punishing them or as if you are scolding them. So what to do? Before asking the other partner, I'm sorry to ask you, but by any chance any other partner? Mind your voice tone, mind your facial expression when you are asking, especially in sexual history, because it is a sensitive and like embarrassing area to be asked to any patient. Okay. You will find it in the notes as well, but you can add 2 points. For example, you will ask the patient, which route of sex you prefer? You will ask this question, like for example, oral or vaginal sex or anal sex. Why? Because in some stations, the STIs, you can find the patient is vulnerable due to having multiple relations. He was homosexual and heterosexual as well, so his orientation is variable here. So you have to ask this question. You will find it maybe in 2 or 3 stations in PLAB 2. So you have to be specific sometimes. I mean, even if you do not remember this question, but please make sure that you ask the previous questions very well. This is the full. Again, number 1, are you sexually active? Start like this sequence, please. Follow the sequence. Number 1, sexually active. Number 2, stable partner or stable relationship. Number 3, safe sex. Number 4, any unprotected sex. Number 5, I'm sorry, any other partner. Number 7 as well is did you practice unprotected sex with him or not? So this is regarding the sexual history. Then another part is the ear pain. The ear pain is just simple pain, SOCRATES. But there are some specific questions not to be forgotten in the ear pain stations. Which portions or which questions? Number one, after the lifestyle, you have to ask the patient 3 important questions. Have you traveled by plane? Why? For the barotrauma. Number 2, do you swim? Number 3, have you used Q-tips or not? Q-tips are simply like some tips or some like something to clean the ear, but sometimes it can cause some injury to the ear. And this is one of the most important reasons to the otitis externa and the impaction of the earwax inside. Okay. After the ear pain, one important and one challenging questions are the elaboration of the chronic diseases. For example, when the patient is telling you that, doctor, I'm having high blood pressure, for example, when you are taking the past medical history and you ask the patient, do you have any medical condition? He's going to tell you, yes, doctor, I'm having high blood pressure. You will ask like this, either high blood pressure or diabetes or whatever. You will ask the patient, when was it diagnosed? How is it managed? For example, he tells you, I'm taking Ramipril. Do you take it regularly? Is there any recent change in the dose? Any extra or missing dose? Do you say that your blood pressure is well controlled? For example, do you have any symptoms? Like what, doctor? Now you will mention the relevant symptoms of the disease. For example, if you're asking about hypertension, you will ask about any heart racing, any headache, any blurry vision. If you're asking about diabetes, you can ask about, do you feel thirsty? Do you go to the loo more often? Loo means the bathroom or the bathroom, okay? But you will find it repeated too much in the scripts in PLAB 2. Okay, do you have any complications? Now mention the complications of the relevant disease. You will find it in the stations. Do you attend follow-up regularly? Are you regular with your GP? Those are the most important questions to be asked in any chronic disease. You will find it provided to you in the short notes for this class. This class is having many short notes. Why? Because simply this is the most important class in the course. Why? Because many things or most of the stations are built upon it. Once you develop the approach that I'm telling you about, you cannot imagine how this will cut your way short in the scripts. Okay. Some few tips not to be forgotten. The most important tip, the extra tip that many people overlook actually. Okay, it's extra. But sometimes it's important because it will give you better marks and better impression. You have to signpost before moving from each set of questions in the history to the next set. For example, if you finished elaborating the presenting complaint and you ask the patient, do you have anything else? He says no. Now at this point you will tell the patient, when someone comes with this complaint, for example, when someone comes with pain, we need to ask some questions which can be related to this pain. So by any chance, do you have any fever? What about any cough? So this is signposting. Signposting means that to show the patient what you're going to ask about, or to give him an idea what you are going to ask about, and also to give the examiner the impression that you know what you're asking about. You're just not asking randomly or irrelevantly. You are picking very precise questions which can be related to the presenting complaint. Okay, before asking about the past medical history or the maftosa, you will tell the patient few questions about your general health. Or I'm going to ask you a few questions about your general health. Before moving to the lifestyle, you will ask the patient few questions about your lifestyle. Signposting is very important before sexual history, as I told you a while ago. Okay, those are the most remarkable things what the people miss. You will find some few tips regarding the history. Your history should be number 1, presenting complaint, number 2, associating symptoms, number 3, differential diagnosis. And in the differentials, always make sure that you ask about the cancer and the emergencies first. How? The emergency, for example, when someone is coming with chest pain, it's very important to rule out in the DDs, very important to rule out the pulmonary embolism. We call this red flags. Red flags are the emergencies which can be related to the relevant complaint. For example, what is the emergency in chest pain apart from the ACS? Definitely the pulmonary embolism and the arrhythmia. Any other complaint, like what? For example, what is the red flag or what is the emergency in cases of the loin pain? Loin pain can be having one red flag, which could be pyelonephritis. So the pyelonephritis always comes first. So in the acute complaints, please make sure that you rule out the emergencies as a top differential diagnosis, and also make sure that you rule out the cancer. So the most important DDs are always, if you are having too many differential diagnoses in one station, always prioritize the emergencies, number 2, the cancer. Emergencies and the cancer. Why? Because these are the most fearful things, the most thing that you fear in any patient who comes to you. Number 4, past medical history or maftosa. Number 5, lifestyle questions. Number 6, specific questions which you mentioned before, like for example, specific questions for the breast, specific questions for the skin, specific questions for the ear pain. Number 7, the 4 P's. 4 P's, as I told you, pills, period, pregnancy. By the way, the 4th P is a perspiculum examination. The pap smear. The 4th P is a pap smear. Do not ask this question. Why we call them 4 Ps? They are found in all the references as 4 Ps questions. But we only ask the 3 Ps. What are them? The periods, pills, and pregnancy. Okay, after finishing the history, now thank the patient and tell him or her, thank you for bearing with me and answering all my questions. Right now I'm going to examine you. I'm going to check your vitals, including your blood pressure, your oxygen, your pulse rate, your breathing rate, and your body temperature. I'm going to have a look at you from head to toe. What is the look from head to toe? It is a general physical examination. And I'm going to examine, for example, your chest. So number 1, check the vitals. Number 2, general physical examination. Number 3, the specific examination. After the examinations, say that I'm going to do some investigations. Sometimes the examiner will tell you which investigation. Now you have to mention the investigations that you need to do. But if the examiner did not ask you which investigations, this means that he doesn't need to listen to them from you now. He needs you to tell them to the patient after disclosing the management. For example, he will tell the patient we will also need to do some investigations. This will come, you will know about this when we come to the teaching. But let me demonstrate some example for you. For example, okay, thank you Mr. John for bearing with me and answering my questions. Right now, I'm going to examine you. I'm going to check your vitals, including your blood pressure, your pulse rate, your breathing rate, your oxygen saturation, and your body temperature. Also, I'm going to have a look at you from head to toe. I'm going to examine your chest as well. I'm going also to do some investigations. The examiner keeps quiet. Or the examiner asks you which investigation, doctor. You will say, I'm going to do some routine blood tests, including the heart enzymes. I'm going also to perform ECG to trace your heart rate and rhythm. And I'm going to do chest x-ray. Why the examiner asks you which investigation? Because in case he asks you this question, this means that the investigations will give you important finding. Okay. So, a very important thing to remember in the history, and what of the most people ask, do not forget to signpost before moving from each compartment to the next one. And please do not forget to be structured. You will receive 9 points your history should be composed of 9 points. Please follow this structure. Do not compromise any structure. Please do not compromise any structure and do not alter the things. Spend 2 or even 3 days doing nothing in PLAB 2. Do nothing. Just stand in front of your mirror and try to memorize this pattern of questions. When you start studying, this will save half of your time of the study. And this is what the other people tried, and this is what I tried personally.